So today we're going to be talking about ADHD. I've witnessed a resurgence, in social media and lots of people getting diagnosed as a way that I perceive it, that it's gone away and come back.
But now our perceptions are evolving. We've got a lot more research, and we also need to think about the impact of COVID. So we had people at home for long periods of time, children and adults trying to work, school. And it's really since then that we've seen this kind of huge uplift.
Looking at the context of the executive, what are some of the things that a person that may potentially have ADHD want to be aware of?
Being vulnerable enough to explore how your symptoms might impact you and consider what strengths you have in your team to buffer some of your weaknesses is what's going to allow you to perform at an even higher level.
Jess, welcome to the UltraGrowth podcast. How are you going?
I'm good, thank you, IJ. How are you?
I'm really, really well, thank you. So today we're going to be talking about ADHD. It's a fascinating subject. And, for me, it feels like there's been a real resurgence of the dialogue around ADHD. I remember growing up as a kid in the late 80s and early 90s. It was a big thing, and it felt like it kind of went away. Now, that might be my perception, but I've witnessed a resurgence, on social media and lots of people getting diagnosed with ADHD. Now, just want to challenge my perception. Like, am I kind of making a mistake in the way that I'm actually thinking about this? Has this been something that's been going on, or has the way that I perceive it in that it's gone away and come back real?
It's a really good question. And I do think it's been bubbling away under the surface. But I think as a society, our perceptions have changed of it. And also having grown up in the late 80s, early 90s as well. At the time, it was kind of, you had a few boys in the classroom who were maybe had to step out to take medication. But now our perceptions are evolving. We've got a lot more research, and we also need to think about the impact of COVID. So we had people at home for long periods of time, children and adults trying to work, school. And it's really since then that we've seen this kind of huge uplift. But we've also had diagnostic changes. So when we were growing up, you could only diagnose ADHD or autism. Whereas in 2013, the DSM-5, which is the diagnostic criteria that we use clinically, it changed to understand that we can actually diagnose ADHD and autism together. They're actually up to 80% co-occurring. So the kind of perception and shift that you are seeing, I don't think it's unfounded. There's a lot more with Instagram, TikTok, and especially this discussion that we're having around ADHD in women and ADHD in adults. Typically, it was thought of as a childhood disorder, and for some reason, we kind of thought that it just stopped at 18. We know that that's not the case. This is a lifelong neurodevelopmental condition, which means it's how our brain is formed.
Do you think social media is helped create awareness around ADHD?
Absolutely. And I've seen it in my own clinical practice, both when I was working in the NHS, but also in private practice. I'm based in the UK, and so we have seen a kind of huge increase in demand, in some places over 400% increase in demand
Wow.
for ADHD assessments. And it's gone from being a condition that's been under-recognized. And we were, in terms of population prevalence in the West, we know that the prevalence is around 5 to 7%. We really weren't diagnosing at that level. And we're still not there. So even though it feels like it's in our minds, we're still not actually reaching the diagnostic level, which means a number of people are likely to be going undiagnosed or untreated should they wish to go down that route.
A really interesting comment you just made about the West. Does ADHD does it present itself as more prevalent in certain cultures and societies?
That's a really, really good question. And it presents itself across the globe. But it's more around where our research is based. The big universities tend to be in the US and in Europe. Really interestingly, so I work for a medtech company where we support with ADHD diagnostics, and we're actually supporting the Maori population to kind of work with and understand more about how ADHD presents in their culture. So it is across the globe, but you're going to get individual differences based on your community, your environmental context. And that's something I think we're really learning more about. But at the moment, when I'm referring to Western prevalence, it's because it's where our research data pool is currently centralized, unfortunately.
Is there any evidence to suggest that in societies where there's more stimulation, external stimuli, that ADHD is more prevalent? Do we know that or not?
It depends what you mean in terms of external stimuli. And I think partly what we've seen in terms of why it feels so prevalent and why we're noticing our lack of attention is because of how our work has changed. A lot of us now work from home or we work remotely. We're very digitally minded. We're on our laptops, we're on our phones, we're on our tablets. And so where you're in populations where you are stimulated by your environment, but your environment is outside. So maybe that's in a farming community, for example, or for you're in a tribal population, for example. Those skills of being able to shift attention quickly, being quick to thinking and problem solving are absolutely going to be beneficial to you. But when you're at your desk trying to keep focused on a Teams call that's gone on for an hour and a half, all of a sudden it's not feeling like it's as beneficial to you because your attention is wavering, as we would expect for most people. So environmental context is hugely important, regardless of who you are, and whether or not your ADHD symptoms feel like they are benefiting you or impacting you in that moment.
It's interesting because it makes me think like for a person that might be working in a context where uh, sitting down or a certain type of focus isn't required, it may not present itself as challenging. Is that a proper assumption?
But yeah, I think that's really fair because the diagnostics is around impact on functioning. And so we think about kind of where ADHD is impacting you negatively once it reaches the point of impairment. But we actually know that there's a number of strengths with ADHD as well, which I also think probably contributes to why people are not necessarily diagnosed. Because over time, people tend to find their way with things that they specialize in. Okay, I've got hyper focus in this particular area. I'm going to set up a business based on this. Or, you know what? I know that I love being outside. I love climbing. That works really well for me. So maybe I'm going to go into tree surgery and I'm going to spend my time or be a ranger and I'm going to be out on kind of doing things that match my skill set.
How does ADHD present itself differently to children versus adults?
It's a really good question. And there's definitely like differences over the lifespan that we see. And I think a lot of us have the kind of mindset of kind of young boys presenting. So you're thinking about that hyperactive, impulsive kid in the classroom. A lot of people get labeled with the kind of class clown sort of approach as well. But generally, you see in the younger age groups more activity levels. Part of that is being challenged now as we're understanding more around different subtypes of ADHD. So we have something called predominantly combined type, which is looking at your activity levels, your impulsivity, and your levels of attention. But we also have different subtypes. One of them is predominantly inattentive type, and we have predominantly hyperactive impulsive type. And so girls or those with co-occurring needs such as autism may present a bit more inattentive, a bit more daydreaming, that sort of thing. And then as you get older, your symptoms change. So around 15, 16, our brains undergo something called neuronal pruning, which is where we select for the pathways that we know that we're going to use, that we're kind of utilizing more often. And we begin to see what we call symptom decay. And generally that happens to the hyperactivity. So it's unlikely that you're going to be in an office setting and having your colleague kind of whizzing around doing laps. Generally, by that point, our brains have selected kind of for some of the stronger pathways that we need. And whilst we're not physically restless, the restlessness might become more internal. And that at times can present more like series of anxious thoughts, or you may have interacted with someone who can jump from topic to topic. So you're starting here and you think you're on track and you're talking about one particular task, but all of a sudden you're 20 steps on and you're not quite sure how you've got there. And so we term that cognitive restlessness, that kind of tangential thinking, which can be absolutely fantastic if you are in a environment where ideas are needing to be generated, but can also be hard to keep up with at times. So again, it's down to context.
I was having conversation with some of my directors, and some of their feedback was that I can change path a lot. But when I reflected on it with another member of the business, we kind of realized that I don't necessarily change path a lot, but I expose people to a myriad of thoughts that go from here to there to there to there. And I speak quick, I think quick. And generally, when I'm talking to someone, I'm kind of pacing them to get to where I want to go. And I don't know how much of that's just being a control freak, but it's interesting that you're just reflecting on what you're saying, because it's almost like a heightened state of anxiety or panic, but thoughts just moving a million miles an hour. And I've just kind of learned to live with it. And by the end of the night, I'm hammered. And I don't know if that is symptomatic of ADHD or just too much coffee or combination of all things, but that's really interesting, right? Like the thoughts moving all around, and maybe just learning to kind of know what to share and when to share things.
Yeah. Yeah. And I guess those with ADHD can have especially once you've got to adulthood, if you've had a good level of scaffolding, you can project those ideas and then turn that into something tangible. But you'll naturally have that kind of quick problem solving. And it sounds almost like you're processing out loud. You're going, okay, well, if we started this, but then actually that's going to bring up X, Y, and Z. So in theory, we would need to go here, or we'd need a plan for if this situation happened. And that kind of ability to quickly think on your feet in a leadership role can be fantastic, because you're able to perceive all different kinds of risk. If the person listening to that is not quite on the same thread, it might be perceived as, like you say, overwhelming, too much information. That's not where we were going with this conversation. But again, I would challenge is it's still a gift to be able to think of all of these possible outcomes rather than being stuck on a single track path.
Sometimes I'm worried about how the other person may perceive that. Am I cutting them off? Am I just moving from pillar to post? And I think there's some learning there. Sorry, I digress. How does ADHD present itself differently in women? Because I noticed that we're starting to see a lot of, dialogue, and hearing a lot of dialogue around how ADHD actually presents itself differently in women. Now, is that true?
Yeah, no, we are absolutely kind of thinking a lot more around differences in women. And really where that's come from is you're probably aware, RJ, that a lot of our medical research is based on men. male populations. And so as a result, when we're factoring in like monthly hormonal fluctuations that women have, um, things like perimenopause, menopause, but also men and women biologically do respond differently to different situations as well. We do absolutely see a difference in symptomology. And that's not to say that women can't be hyperactive or they're only inattentive or that sort of thing. But it's really important to understand some of the nuances. And equally, all men don't present one way, all women don't present another way. But we do need to think more about the inattentive type, particularly in the younger years. So do you have a girl that's possibly really keen to do well, feeling like she's got a lot of perfectionist traits, but she's at the back of the class? She's not causing a problem, but she's daydreaming and she's zoning out. We see more of those difficulties with executive function. So organization, keeping on task. And it might be that they then overcompensate. So again, how that can transpire in the workplace or in family life, people who have got lists and color codes for absolutely anything. They've got multiple apps to try and manage their life. There might be someone who is extremely busy and you're looking at them going, how are you juggling career, family, keeping this all together? But they're struggling to slow down or sit still or kind of take time for themselves. So it's that constant on the go. It can also be that kind of loss of focus or difficulties with relationships. We know in ADHD that we see increased levels of divorce rate, for example, but you see it in the teenage girls as well, that you have more fallouts with friends. Making those long-lasting relationships can be really, really challenging. And also kind of following on from that train of thought is we're seeing a lot more women now, once they're reaching their perimenopausal state, or if they're postpartum, that because of these huge shifts that you get in your hormone functioning, you can be treated for depression. You could be put on HRT, but there are still residual symptoms there. And there's been a bit of an awakening of going, okay, we've got a cohort of women who have long-standing ADHD, but have always managed to function. They may have burnt out periodically. They may have identified themselves as anxious or never been able to get on top of things. And it's not really until that stage where you stop and take stock and think of everything else. And with this increased awareness now, that we're going, okay, we've got this whole group of women that we've missed. I'm also really mindful there that we have also got members of our community who have transitioned from male to female and female to male. And again, we need to think really carefully around how we accommodate people who have been on their own journey with kind of gender and sex, where hormone treatment has come into play or where it hasn't, and being really accurate around people's individual experiences of these ADHD symptoms. And so from a clinical perspective, it's really important that we be really curious across the lifespan and we don't just look for someone who's been hyperactive in your face, and instead, have they got these more subtle symptoms? Have they presented with long-standing depression and anxiety that hasn't shifted? And could we account for these symptoms in different ways?
Is there a correlation between alcohol and drug abuse and undiagnosed ADHD?
Again, a really good question. So we do see increased use of substances in the ADHD population. My speciality has predominantly focused around young people. I'm working in London for the majority of my career, working around gang culture as well. And I see it in teenagers right through as I've kind of ventured more into the adult realm of ADHD, utilizing substances to self-medicate, to bring yourself down. And that's not just illegal substances. Some people drink 10 espressos a day, which might sound really alarming. But for someone who has ADHD, you can often feel a paradoxical effect of a stimulant. And so something like coffee can actually give you some calm and focus for some of our ADHD population. But you're absolutely right. We also have illicit substances. We have addiction, which can muddy the waters as well. Not only from the kind of vulnerability, impulsivity that you see in the teens. Hey, can you just take this and run this over to this guy over here? Um, but also where people feel like they've got so much going on in their head, the temptation to try something to calm like thoughts and reduce that fast pace, you can understand it, can't you? And so again, when we are thinking about supporting people in substance misuse services or the forensic population, thinking about neurodivergence and what may have led them onto this path, you don't just want to look at the end result. What have we missed along the way, which might be impacting this person?
Yeah, that's interesting. I've been in recovery for about 15 years, and in the rooms of recovery, we talk about like the spiritual dis-ease or the restlessness, irritable, and discontentness. And it's interesting because in the framework of 12 steps, we look at it as a spiritual malady, but one could label that in any form. I mean, I'm 15 years sober, and you get me alone in a quiet room, I may not be able to sit down for very long, right? There's kind of always this low level of anxiety frequency going on, right? That I've kind of learned to manage through sobriety. And you look at particularly newcomers that get sober, the level of noise in their head is overwhelming. It's overwhelming for most people. That's why our numbers are so low. And one has to wonder, you know, what's going on for them or for us chemically. Uh, and it's interesting because for a lot of the young people, as you'd know, they're just medicating, and then you throw on the complexity of, um, things being against the law, and now they're caught up in the system, right? The whole time they was just trying to medicate, right? It's tough. It's tough.
It is, and that's also why I think increasing awareness. Um, uh, we have a lot again in the UK. We have a lot of ADHD clinicians also working in custody suites, and in kind of secure homes in the prison setting as well, to really tease that out. There's lots of factors. I don't want to be reductionist in thinking like, yeah, it's undiagnosed neurodiversity, which leads someone down the path of substance misuse. People can have a number of experiences which may take them kind of down that route. And I'm sure you've seen that a lot within the meetings and heard a lot of stories. But it's one thing that I think we should be considering in terms of, is there an earlier almost predisposition to needing to self-medicate to manage that noise, as you said as well? Where does that anxiety come from? And a really good ADHD assessment also incorporates a mental health assessment and considers your kind of physiological state as well. And so the purpose of creating a real individualized approach to ADHD care is thinking, okay, especially in adults, what path has this person walked? What are the influences? These assessments are never easy, and trying to understand, okay, is ADHD a piece of this pie, which may have made things more of a challenge when this person didn't understand this part of themselves?
In terms of those assessments, how have they changed or evolved over the years?
It's really interesting to think about the differences that we've had. I've been assessing ADHD for around kind of 12 years now, and it's definitely kind of growing and changing. So not only, as we've already touched on, who's coming through the door for an ADHD assessment, but also the tools that we use. So as diagnostic criteria has updated, we're thinking more broadly around interactions between mental health and physical health, but we're also starting to bring in digital tools. I mentioned earlier that I work within the medtech space. I work for a company called Qbtech, and we are one solution that provides objective data when thinking about an ADHD assessment. So Historically, how you would assess for ADHD is you would get a history from the individual, whether you're a child or an adult, around your own experience of symptoms. You would get some questionnaires completed, which we call rating scales, which are mapped against the diagnostic criteria. And that's done by you, if it's appropriate, parents or partner, if you're a child, your teachers. And we try and get corroborative information from work in the adult setting. But now we have this objective approach to look at core symptoms of activity, inattention, and impulsivity in ADHD, which our devices, Qbtest and Qbtech, can offer. And that can really cut through, especially if people have managed to learn strategies to mask or camouflage their symptoms over time, which we see more so like in the adult population, but you do still get it in kids and teens as well. It can give you a visual representation of where this person's strengths are and where their needs really come in as well.
I'm just trying to conceptualize that. Like, how do you actually deliver a ADHD digitally? Like, what does that look like for me if I want to take the test? Because that's interesting.
Yeah, absolutely. So there's two different forms. So the QB test itself is an in-clinic assessment tool. So you would come in, you would see your practitioner or one of their team, and you'd be physically sat at a desk with a laptop performing a computerized task. You then have an infrared camera that doesn't record you, but it's actually mapping a reflective marker that is sat on a band on your forehead. So it kind of tracks the activity that way. And as an adult, you're doing a 20-minute task, and we're measuring your attention and impulsivity by how you respond to this purposefully kind of boring computerized task, which is there to stress out the symptoms. If you are working in a more remote setting or you can't get into clinic, for example, we also have Qbtech. And that can also be done in clinic. It's on a laptop. You don't have the headband for this one, but you can also send that remotely to someone as well. So we're obviously in different countries. I, from the UK, can send you a voucher, RJ, over to Australia and ask you to complete it in your own time. It would then notify me once you've completed it. It's exactly the same task. It just utilizes the camera in your own laptop to track your movement.
So does this now mean that we can actually move into societies where ADHD clinics and practitioners like yourself may not exist? This is now a scalable way to actually reach individuals previously not reachable?
Yeah, absolutely. So you still require the clinician to interpret and take clinical responsibility, but it does mean that we can reach communities that may have limited access to healthcare. So our company is also in the US, is also in Australia and New Zealand as well. But it means that I mentioned the Maori population earlier, if you're not routinely kind of able to come into clinic, if you've got the right tools provided, you can absolutely reach broader aspects of your population. And we're seeing that more in the States as well. There are a lot of rural communities who just haven't had access to this level of healthcare. And we're doing a lot of work in order to improve access and improve reach for those who can't travel hundreds of miles to get into a clinic.
I wonder when you have accumulated more data from communities where there is currently no data, if you guys will find that ADHD presents itself even differently among certain cultural context.
Yeah, it's a really interesting kind of consideration. We're really lucky that we have a research team at Qbtech who does consider all these different factors. So when we are looking at the results of these objective measures I was talking about, it gets compared to a norm group who we know do not have ADHD. But as we are progressing, as new products are evolving, we're looking at different populations, we're looking at different parameters and gathering more information to really improve access and the evidence base behind ADHD. So I think you're going to see, as digital tech in healthcare expands, there's going to be more of a movement to kind of improving access to healthcare, but also reducing the time we're waiting for it. Because at least in the UK, some regions are waiting 4 or 5 years for an ADHD assessment. And so we really want to bring that down as well.
And cost too, right?
Yeah. Yeah. If you're using less clinical time, you're able to reach a decision quicker, is going to be more cost effective if you're not having to travel out or have an overhead clinic space. We've got all these different ways now which just weren't available to us pre-2020. And so as challenging as the pandemic was, we've seen this real burst in technology and things are really driving forward. There's a lot of change on the horizon, which will hopefully benefit those who are sat at home thinking, okay, I think I might have ADHD. What do I do about this now?
Looking at the context of the executive, how might ADHD present challenges around daily life as a high performing executive, decision making, leadership? Like, what are some of the things that a person that who may potentially have ADHD want to be aware of, or someone that has acknowledged they have ADHD?
So I think in the executive and in the leadership space as well, ADHD can come as a strength or uh, it can also be an area of difference as well. We've already touched a little bit on burnout. So there may be that tenacity to just keep going, just get on to the next thing and finding it difficult to put down a task. With any leader, if you've got ADHD diagnosed or undiagnosed, it's really about knowing and understanding yourself. I think there's also, with the shift in understanding about ADHD, there's also been a shift in coaching culture, whether it's an ADHD coach or with kind of executive leadership coaching as well. And having that sounding board to bounce off of can be hugely beneficial. We need to weigh up when we're thinking about ADHD and executive leadership around the offset of procrastination of boring tasks, stuff that you're not really keen on, it doesn't spark your interest, and how those get done or how those get delegated, especially if they are a priority but not an exciting task, versus the impulsivity to make a decision and move forward. Whilst again, that can be beneficial if you're really quick to problem solve and weigh out the pros and cons, that ordinarily when you're working in a leadership team, like you've mentioned before, you've got directors, there are other stakeholders involved. And so it's making sure you've got those checks and balances in place to know, hold on, these are my strengths. My tendency is to push forward or make a decision in this way. What are the checks and balances that we have in place to ensure everyone else is up to speed and on board and we're not just jumping straight into the risk? There's a need for the strength of an ADHD brain, and you see a lot of entrepreneurs who present with ADHD, partly because that kind of mainstream culture of work, responding to the needs of others, can be less exciting. And so that chase to be at the top, that entrepreneurial spirit, can really mix well with an ADHD mind. But as your business grows, and when it's not just you and maybe one or two others making the decisions, is what safeguards are in place. And with any leader, I've worked in leadership for the last kind of 10 years or so, is really about thinking about your own resiliences. How am I not going to burn out? How am I going to scaffold my team, create some safety? How do I make sure that I'm listening? But also thinking about, okay, what are the needs of other people here? And do I need to do any learning or introspection on myself in order to push this company forward? So in summary to your question, I think when you're talking about an executive leadership role and the mix of ADHD, being vulnerable enough to explore how your symptoms might impact you and consider what strengths you have in your team to buffer some of your weaknesses is what's going to allow you to perform at an even higher level.
What's the role of personal development? You know, talking about things like diet, meditation, exercise, like, do we know if that can, I mean, meditation's interesting, right? Physical exercise and then diet. Like if you're eating crap and sugar, how does that then play into the ADHD? Like, can we say that, or do we know that if a person that's living a life kind of driven by discipline, personal development, do they typically respond better to ADHD or not?
It's a great question. And we do actually see examples of that in clinical practice. And I think it's really important to say that anyone who is taking time to look after themselves, ADHD or not, you're going to get better outcomes. If you can work on your sleep, we know that meditation increases the level of serotonin as your feel good neurotransmitter within your frontal lobe. So your brain is going to respond well to self care and time out. But we know from a dietary perspective that if we are eating healthy, there's a lot more research now around the gut microbiome. We know that a lot of our like serotonergic, dopaminergic neurotransmitters, which impact our mental health, are based in the gut. So if you are eating healthy and you have good gut health, is going to improve your brain health as well. Equally, if you're being mindful enough to think about what is it I'm putting into my body? What routine is going to work for me? Just as a whole, if you're not kind of going through life chaotically on 3 hours sleep, kind of responding to needs here and there, like living off espresso, you're not going to, no one is going to function well. And for those with ADHD, you may be more prone to kind of lean into that sort of chaos because you're good at working on the fly. You're good at being impulsive. You're like, hey, 2 hours sleep, that's my superpower. But is it? Well, if you actually got that full 8 hours sleep, if you took time to care for yourself, I guarantee that your brain would love you for it. And that's the same with anyone ADHD or not. But I think as we grow into adulthood and even what we're teaching our children and how we're scaffolding them, having good health, good diet, impactive exercise, even just to create that discipline and time away from the screen is going to be best beneficial for your overall health and therefore your overall cognitive well-being as well. There's no downside to looking after yourself.
What's the role of medication with ADHD?
So we do have medications for ADHD that fall into two categories. They've got different names depending where in the world you are, but they all kind of are doing the same sort of thing. So you've got your stimulant medications, which work very quickly and generally last for a 4, 8, or 12-hour period. And you also have your non-stimulant medications, which take longer to build up. So you need to take them consistently for 4 to 6 weeks, and they work around the clock. They're one of the most effective medications that we have in psychiatry, and they can be hugely beneficial if you have chosen to go down that route to manage your ADHD. In children, we generally see that we're prescribing to help them through the education system. And I'm a non-medical prescriber myself, and so we really try to tailor it to what the child is doing. What does your school day look like? What after-school clubs do you have? When would medication be a benefit based on how your ADHD symptoms present? As we move into adulthood, we can think a little bit more flexibly, not only around when would you remember to take the medication, but what do you actually need it for? What are the strengths that your ADHD brings? So if you're kind of needing to bring a lot of ideas, maybe you don't want to have medication for that particular time. But actually, if you know you've got a report or you know you have a task which is going to require a lot of focus, it might be that treating the ADHD with a 4-hour medication could be a benefit to you. And again, going back to the discussion earlier that we have around digital tools, we can now utilize these objective measures to see how well the medication is managing different aspects of your ADHD. Is it supporting your activity? Is it supporting your attention or your impulsivity? Is it doing what you wanted it to do to optimize your performance? But I should stress it's absolutely a choice on the individual. And it's an option that people have if they wish to treat their ADHD. But you can also treat as you've discussed, diet, exercise, using routines and non-pharmacological approaches.
What are the environmental factors that someone should be, whether it's a person developing awareness for themselves in respect to how their environmental factors might impact their ADHD, or a company being mindful of environmental factors that might affect their staff or people? Like, what are some of those factors that one would want to be mindful of when thinking about the impact on ADHD?
So when we're thinking about like environment and context, for some people with ADHD, it also comes with a sensory element as well. So you want to think about your level of distractibility, but you also want to think about sensory needs. And what I mean by sensory needs may be the impact of lighting, might be the impact of noise. And if you're in a busy work environment, let's say an open plan office, is your individual more likely to get overwhelmed or distracted? Are they going to be tempted to kind of wander off or engage in conversations elsewhere in the office? Going back to what you mentioned around levels of activity, if you're sat at a desk for long periods of time, is that going to be most productive? Not just for your employee with ADHD, but just in general. Having the options of standing desks, walking pads can really kind of benefit. And we know that it helps with laying down memories as well. If you're moving, if you are active, you may be more productive in the workplace. And even thinking more flexibly now, working from home can be of real benefit for some people. Again, I would hate to have that blanket approach, but you're going to have some ADHD individuals who go, okay, if I'm needing to get a task done or I'm needing to work with my team, in the office is best for me. I want to be in person. I want to throw those ideas around. But if you need me to be writing reports, following this up, working from home, I've managed my distractions. I know that I've got nothing on my desk. I've got my routine. That's what works for me. Again, it's going to be the same. And I'm talking about this from my own leadership perspective as well. It's not a one size that fits all, but it's being open to thinking about, okay, what promotes you best? What's going to get the best out of you from a workplace side of things? What adjustments can we make? Is it an easy lift? Is a standing desk and a stool something that actually is super easy for us to provide? And we can support you to get a walking pad or make sure that you take a 20-minute break to walk around the block. Or do you need to have a discussion with your employee and go, okay, this is what we have within our company. This is what we need from you to kind of meet us in between. But I think having the environment where psychological safety and being open around your needs is promoted can only be a benefit, because if you can go to your manager and say, okay, I'm really struggling today. My focus is off, or I didn't take my meds, or for whatever reason, my ADHD is impacting. I'm going to take 15 minutes. I'm going to reset, and then I'm going to come back because I'll be more productive. Respecting people's autonomy and them knowing themselves can go a long way. Again, ADHD or otherwise.
I feel like some of the most gifted staff and people that I've ever led have their unique uh, idiosyncrasies that, some come with diagnoses, some don't. And learning to harness the strengths and support the challenges isn't easy. It could be heavy
Yeah.
as a leader sometimes, but I think the net outcome is beneficial for all parties, and it's the right thing to do.
I would agree. And ADHD, we know very rarely comes on its own. Is very rarely just ADHD. You're more likely to have traits or a diagnosis of autism, dyslexia, or another specific learning need. None of these impact your IQ. Like you say, you could have a very gifted individual. But now that we're seeing increased tools that we can use in the workplace, whether it's an AI integration to help with tone of emails, or like we've said, working from home or different spaces in the office, adaptability is starting to be more built in. It's just for us to have those conversations. But it also gives us an opportunity as leaders ourselves to think, actually, what do I need? And how can I share that with my team and have an open discussion around this?
Are we seeing changes in the way that we educate our kids? I mean, sometimes I feel the most or the least innovative space is childhood education for some weird reason. Like you think there'd be a lot of innovation and change, but the whole sitting still for hours upon hours and particularly when I go to my son's school, I see the boys are like chimpanzees. They're hanging off the walls and like they're just going crazy, right? And you're kind of wondering, well, it's kind of weird that you got these little humans corralled in a little room. Like, are we starting to see some questioning around the way that we're educating kids, particularly through the lens of ADHD?
There's more adjustments being made. And I think in the earlier years, you're seeing more options come into play. But you're right. So, like in nursery years, you can get forest school and that sort of thing. And people do have an awareness of reasonable adjustments at school. But from what I've seen, I'm not a teacher. It is very classroom based. And you're the expectation is to sit at your desk and learn for long periods. And then when you get into teenage years, some lessons are 90 minutes long, which I don't think serves anyone. I don't think I could sit for 90 minutes doing one subject. So I think as awareness grows, things will naturally change. And again, individual schools, individual teachers, there's varying levels at this time. But I think as an environment, there's probably still a long way to go in the education system. But I think as we're getting into higher education, at least in the UK, we're seeing more of apprenticeships, being offered now, more practical routes into work rather than that standard university. So for those who are better with book learning and being in the classroom setting, you've got a route. Whereas those who do better on the job and can absorb through interaction and observing others, taking the apprenticeship route could be more beneficial.
Well, thank you so much for your time, Jess. We're gonna leave it there. Where can our audience learn more about Qbtech and what you guys are doing in ADHD?
So we have qbtech.com and qbtech.co.uk, should any of your listeners wish to find our website and learn more about our products.
Well, thank you so much, Jess, and we will absolutely have all that information in the show notes.
Great. Thank you so much.